All right, let's do a little urgent care rotation recap. So let's start off by saying it was my favorite rotation so far, partially due to the fact that it's always such an exciting day. There's always something new going on, new cases, keeps you on your toes, it's always busy. And I had really awesome preceptors, which just makes everything that much better. I'm sure if you've done a rotation, then you know. Starting off with my schedule. So it varied a lot because some of the urgent cares that we worked at are 24 hours. So sometimes my shifts would be like 8 to 5, and then other times it would be 5 to 1 a.m. So it just depended, and of course you work weekends in the urgent care, but it was fun. I enjoyed every day. It was nice to actually look forward to go to work every day. So what do I think you should prepare? I don't know. I think that honestly, everything that you're doing up until this point kind of prepares you for this rotation. In terms of that, I mean that like a lot of things started to finally stick because I would see these things that were more critical patients, more like acute settings that you wouldn't see like necessarily in certain specialties or in family medicine, and it was so cool to finally see these things in real life, things like appendicitis and diverticulitis and fractures, and yeah, it's pretty cool to have everything solidified and see real life cases of it. Suturing for the first time. First thing I did was someone's eyebrow laceration. Honestly, I felt like the lidocaine part, the numbing portion of it, was harder for me than the actual suturing. One, because like the little doohickey, I had one here. The syringe is kind of awkward to like make sure you hold it properly and like not shake. And then also the lidocaine burns, so I hate like instilling pain on someone. And then the sutures, they're already numbed up, so it's so much easier for me once they're already numb to be less nervous because I'm not hurting them. To me, that's the part that is the most nerve-wracking, when you're actually inflicting pain on them. So I did, I think, 2 eyebrow lacerations this month and a finger laceration. We did an incision and drainage, which was also cool, also difficult to numb or get the hang of numbing. What else did we do? I really liked that some of the urgent cares I worked at had their like baby ERs where they have like CT scan, all the blood work capabilities, x-ray, etc. So it's kind of really cool to see your patient from start to finish and see exactly what they have without just having to refer them out. We tried to avoid referring people to the ER unless they actually needed to go. So that was fun. And then, like I said, I just loved my preceptors. I definitely could see myself working in urgent care, but I also caught myself reminding patients of preventative measures, medicine measures, like, hey, is your diabetes maintained? Are you taking your medications? Are you seeing your primary care? So I gotta see where my heart really lies. But if urgent care is not a definite like rotation that you guys have to do or something on your schedule, I definitely recommend trying it. It was a lot of fun. All my classmates that have done it also enjoyed it. My mentor loved it. So I definitely recommend doing an urgent care rotation for sure. I know I didn't really touch on things to review beforehand. I think definitely acute causes of like abdominal pain, acute causes of shortness of breath, chest pain, those things are really important. And then something I learned on this rotation was things to ask if someone had come in after a motor vehicle accident. So these are things like, were they restrained? Were they the driver? Were the airbags deployed, to see how bad the impact was? You do a full neuro exam. You have to look inside their ears to see if there's any blood there, behind the ears, raccoon eyes for bruising. Did they lose consciousness? All of these things were really important, and I hadn't learned them before. So it's good, really good that I had this rotation before my emergency medicine rotation, which is up next. Follow, subscribe, like, share. See you soon.